Hello guys, we are doing chapter 4, state and federal regulations. So here we go. Our objectives, really, we're just talking about HIPAA today. That's our biggest thing today. And also describing a little bit of the Healthcare Reform Act, which I don't go into a lot of detail, but HIPAA is really important right now. So HIPAA is the Health Insurance Portability and Accountability Act. This was passed in 1996 and it became effective in 2003. It really was not that long ago that this actually went into effect, which is actually surprising to me in my head. HIPAA requires standardization of electronic client health data, administrative data, and financial data, any unique health identifiers for healthcare professionals, and security standards for confidentiality. So the unique health identifiers can be either individuals, employers, health plans, and healthcare professionals. And then the security standards is past, present, and future, along with the integrity of the individual itself. I know this is like one of those dad jokes, which I find really funny. It's funnier when I can see your faces, but knock, knock. Who's there? HIPAA. HIPAA who? I can't tell you that. It's much funnier when I can actually see your faces when I can tell that joke. Anyway, moving on. You guys can laugh and make fun of me later. I don't care. Doesn't bother me. So providers must provide clients with a HIPAA notice of privacy. This is where you sign it at every doctor's office. You have all done it wherever you have gone. And this includes the right to restrict use of PHI. And PHI is protected health information. It allows request confidential communication, inspect and obtain copies of the PHI, any amendment to the PHI, and receive an accounting of PHI disclosures. When you think of PHI, what do you think of? Now, I have a whole list that what I would usually do in class is have you read them off and see if you can get every PHI that I have listed. Unfortunately, I can't do that because you guys aren't in class. So this includes names, any geographical subdivisions smaller than a state, like a street address, city, council, zip code. All elements of dates. So for dates directly related to an individual, like birth date, admission date, discharge date, date of death, and all ages over 89, all elements of dates of every age. Telephone numbers, fax numbers, email addresses, social security numbers, medical records, health plan beneficiary numbers or your insurance card. Account numbers are included in PHI. Any certificate or license numbers. Vehicle identifiers or serial numbers, license plate numbers. Any device identifiers like a 10 unit number, that would be in PHI. Any URLs and any images also is considered a PHI and would be illegal to spread. So if you think about the penalties, a HIPAA violation is a felony, and you can lose not only your job, but you can lose your license as well if you are non-compliant. It can run anywhere from $100 up to $25,000 per person, and they can be upwards of $1.5 million and imprisonment, which, I mean, just don't give away information. That's not hard, right? You can do it. Clinic concerns regarding HIPAA, and I like to talk about this a lot because I think that there are more clinic concerns HIPAA-wise than we actually realize. So privacy notices, making sure that you get it signed and that it's done. The design of the clinic to promote privacy. Who sees who in the clinic? Who hears who in the clinic? Also, who can see your system? I know that our computers were just on, I called it my island, but it was just like a little desk in the middle of the office. Anyone could walk up and see it. That's not private. Security of the computerized information, so making sure there aren't any breaches of the system, and the placement of the computer screens themselves. We had two different systems at Select. We had a documentation system and a scheduling system. And a lot of the times I would schedule my patients just to help out our secretary. And I would ask the patient, I was like, okay, what can you do? And without thinking, the patient would walk over and say, well, what's on your schedule? What do you have open? And then look at my screen and look at the schedule, which had every other patient's name on it, which was illegal. They weren't trying to do it. And I would have to turn my screen and make sure that they weren't looking, but it's without, they don't think that that's, people understand HIPAA, but sometimes they're just not thinking on what their computer screen or what they're actually looking at. There was a Healthcare Reform Act of 2010, which actually didn't start until 2014. This was the most historic domestic policy achievement since Medicare in 1965, which is pretty incredible when you think about it. It is still a constant issue for legislators. People still don't like it. You can't make everyone happy. This really was to make healthcare available to as many people as possible. And also, just they're still struggling to find really what is the best place for all of these healthcare dollars going to. It was trying to put, oh, I'm sorry. So the top three reasons for the Reform Act was make affordable healthcare available to more people, expands that Medicare program, and then support innovative medical care delivery methods designed to lower costs of the healthcare generally. They wanted to put Americans back sort of in the right of what they deserve and in charge of their coverage. So you wouldn't get any pre-existing conditions, no arbitrary recessions of insurance coverage, no lifetime limits. Again, we are still going back and forth on this debate on what is or is not appropriate for all healthcare providers. I'm not sure we're ever going to get a straight answer until they start deciding that it's not about them, it's about the people, and really working together instead of against each other on their own agendas. Conclusion. Wow, this is like the quickest conclusion ever, but make sure you're aware of the state and federal regs and HIPAA. We must also understand that there are numerous changes taking place not only with treatment and research, but organization and methods of delivery of healthcare, and that can change the state and federal regs. So just being aware of all of that. This was a quick lecture today, guys, so you're welcome. I hope you have a good day, and we'll talk to you soon. Bye.